Hey everyone, Dan Julian here, nurse practitioner for Danesthetics Medical. We're continuing our neuromodulator series and today we're focusing around the mouth. So we're going to go over Gummy Smile, lip flip, smoker's lines, and even how to turn up the corners of the mouth. I think you guys are going to love this. Let's get into it. Let's get right into it. The first thing we're treating is the Gummy Smile. And the Gummy Smile is caused by a hyperactivity of the lalasan or aliquanasi muscles, which happen right here and right here. Both of them, when we smile, typically just move up a little bit. For those who have a Gummy Smile, it overcontracts and it pulls all the way up and it shifts this lip up and it shows a little bit too much of the gum. Honestly, for a lot of people, I think it looks good, but for a lot of people, they would prefer to treat that. So how can we calm that down a bit? Well, we have to attack those aliquanasi muscles. And a great way to do that is to just basically, bring in my assistant Sarah and look at the nostrils and go right beside the nostrils, and we're gonna place maybe 1 or 2 units right there. You know, there's no real rule, you're just gonna be right beside the nostril, 1 or 2 millimeters beside it. The muscle is very superficial, so as long as you're breaking the skin with your needle and you're placing your product there, you'll be fine. Some people are pretty sensitive though, so don't go ahead and just place 2 units because you want more longevity. What can potentially happen is it really drops it, and whenever they smile, they'll end up looking like this. And they won't be happy at all with you. So go gentle, and remember, because you're using such a low dose, you might not get the full longevity you're hoping for. Now you can help that if you also want to offer a lip flip. So let's get into that. All right, the lip flip is all about relaxing the upper lip and changing the angle to give the impression that you have a little bit more lip show. For example, the vermilion border is this part right here, the top ridge of the lip. And let's say, for example, my hand represents right here, the knuckles is that vermilion border. On top of it, that's going to be the ergotrid, and this is the lip. This is the vermilion. This is the red part that we see, right? So when I smile, my lip actually curls in a little bit. So here's an example. See how it goes away? So by placing neuromodulator up here, what it's going to do is relax this part of the muscle. It relaxes it down and it kicks it up by changing the angle. And as a result, whenever I smile, this doesn't move. So you get a little bit more lip show even at rest, but the big part is for those who end up having that curl, it keeps it down. You can either do a 2-point or 4-point technique. Basically, look at the Cupid's bow right here. You're gonna go on top of it, and you're going to go 2 millimeters above the vermilion border. And you're gonna place this either superficially or deep, it doesn't really matter, and you can place 1 or 2 units here. Remember, dose is duration, but at the same time, for people who are new to this, it's definitely going to cause a little bit of a side effect with regards to articulating their B's and P's, right? So the whole idea is it's going to relax this pursing motion. So instead of doing that, you'll be able to do this. Remember that. So sometimes you may want to introduce this gradually. You can go anywhere from 2 to 10 units for anyone. I usually start at 4 to 6 units. Most of my clients really like that, but you can push it all the way to 10 if you really want. First 2 points are going to be here, and then the next 2 points are going to be just following the lateral flares of the nose. You're going to bring that straight down, and that's going to be your next points right here. So you can do either 1s or 2 units all across. And then if you really want to go all the way up to 10, then you can place another 2 units right in the middle, right there. Now I did mention that you can use that also with a client who ends up having a Gummy Smile. And the reason why is because sometimes there are 2 things that cause the Gummy Smile. You can have the aliquanasis that pull up, and you can also have the lip that curls in. So sometimes you may need to do both in order to give that perfect treatment. All right, the next treatment is going to be barcode, or they used to be called smoker's lines. I really like to call them pursing lines because that's what causes these lines around the lip, this pursing action. This orbicularis oris is a sphincter, right? It does this as its contraction. It's very similar to the orbicularis oculi. It's another sphincter muscle that does that, which causes these lines here. You just flip it upside down, and that's how you get these lines. Men typically don't get these lines because we have a mustache here, and this mustache acts like beams or pillars of support protecting the lip. So what can we do? We can place neuromodulators there to decrease the visibility of them, or A, prevent them from ever happening. And in my opinion, that's the best option of the use for neuromodulators for around the mouth. Because once these lines are etched in, you're gonna have to kind of throw the kitchen sink at it to kind of get rid of them. And it still will never look perfect. As a benefit, you're likely going to get a little lip flip out of it too. So this technique is very similar to the lip flip. Basically what we're doing is doing a 4-point technique on top. You can use 1 or 2 units per injection point. Remember, dose equals duration. And also you can do 2 points at the bottom here if you're starting to notice these lip lines that are starting to occur. I generally don't recommend more than 10 units all around the mouth. Some people can push it up to 12. It's just that you're really going to have a hard time articulating your B's and P's. And that's typically how neuromodulators work. They're very stiff for the first 2 weeks, and then after they relax, and then, it does its job. Now remember, this muscle is very big and very strong, and we're only using maybe max 10 to 12 units here. So realistically, the duration of a lip flip and also any treatment for barcode lines will likely only last 6 weeks. The last treatment we're going to do today is called kicking up the lateral oral commissures, or kicking up the corners of the mouth. This is done by hitting the DAO muscles, your depressor angular oris muscles. These muscles right here. These muscles, whenever they're flexed, they actually go down. So here we go. And what do neuromodulators do? They relax the muscle. So by kicking in these neuromodulators, it's going to kick it up and give you a little bit of an upturn. If we start noticing that your corners of your mouth start dropping with age, that could be because we tend to lose a little bit of fat here, and the muscle that's underneath it tends to hypercontract and overcompensate, and it starts pulling down. This is your DAO right here, this muscle, depressor angular oris. And the muscle that you really want to pay attention to is the one right in front of it right here. This is your depressor labii inferioris. Also one that when it contracts, it pulls down. So when we smile, that's these 2 muscles right here, the DLI. You really don't want to touch those, because if, for example, I place my product right here, and neuromodulators tend to spread by about 1 centimeter, so it spreads out and hits this one by accident, when you smile, this side will end up doing this. It kind of relaxes and goes up and gives the impression like you have a little mini stroke going on. So don't do that. So first of all, this is your typical landmark. For anyone who's new to injecting, you can use this technique. It works great. To find the lateral oral commissure, move 1 centimeter over, 1 centimeter down, and you can place anywhere from 2 to 5 units here. Remember, dose equals duration, but also the more units you place in one area, it might spread a little bit more as well. So what you could also do is place maybe 2 or 3 units here, and then another 2 units down here, because the muscle spreads all the way down to here as well. And that's another great way of kicking up the DAO. If you're starting to get more advanced, you can actually ask your client to try and make this frown. What I do is I get them to frown, right, find where the tip is, and I don't want to be right in the middle. I actually want to be just on the outside of it so I don't hit this DLI. And what I'm going to do is I'm just going to angle my needles laterally, and I'm going to place my units right there. It's going to spread, it's going to hit what I need, and I'm totally fine. The last thing I'm going to teach you guys is what happens if you end up accidentally hitting this DLI and someone smiles and they got this crook. You have 2 real options. One is you don't do anything, because neuromodulators are always going to wear out. 6 weeks to 8 weeks, it's likely just going to wear out. Or what you can do is place 1 unit or 2 units in the other DLI. And what that will do is just relax that and match the other side. So stay tuned for the next video, everyone. And remember, if you enjoy these videos and you want to see these demos on real clients, then join my Patreon. It's designed for serious medical aesthetics providers just like you. If I don't see you there, well then I'll see you here the next time, where I'm going to move down the face and I'm going to treat the jawline and also the neck. So until the next time, guys, take care of yourselves, exercise daily, and please be nice to absolutely everyone.